Welcome to Using the Escalation Pathway. It's common to feel hesitant and unsure about how to help a struggling trainee. The Escalation Pathway is a framework to provide your trainees with the support they need. Today, we'll walk through the pathway, and later you'll learn how to determine the appropriate steps to take. After recognizing that a trainee needs support, the Escalation Pathway helps you determine the appropriate next step. During your tenure at Rush, you may observe a struggling trainee or be notified of a struggling trainee by a member of their cohort, colleague, or the trainee themselves. Your role is to inform the trainee about available resources, offer support and encouragement to access these resources, and ensure the trainee's confidentiality. After identifying a private space to talk, begin your conversation by naming your observations and offering your support. Use your active listening skills and ask questions to help assess risk of harm. If you are concerned about your trainee's safety, ask the trainee if they have an active plan to hurt themselves or others. If yes, emergency intervention is required. Immediately connect with emergency services by calling 911. Stay with the trainee or on the phone with the trainee until help arrives. Do not escort the trainee to the ER on your own. If the struggling trainee does not have an active plan to hurt themselves or others, continue your discussion. You play an important role supporting this trainee's well-being. Support and advise the trainee based on the resources included in your toolkit, which can be employed to mitigate stress, depression, anxiety, and other challenges. If your trainee expresses a need for more formal support, they can access behavioral health support in the Wellness Center or by calling the Rush Employee Assistance Program. Provide these resources to your trainee. As you employ active listening skills, you will help your trainee feel supported and understand available next steps. If appropriate, discuss whether time away would be beneficial. Remember, the trainee must decide whether or not to request time away. House staff may be eligible for paid or unpaid time off. These benefits and the eligibility requirements are described in the GME Sick and Wellness Days Policy and the Vacation and Leave of Absence Policy. Program directors are encouraged to consult the GME office about individual trainees' leave options. Program directors should consult their board certification policies to determine whether training needs to be extended and for how long. The trainee and the GME office must be notified when a training extension is required. You have the opportunity and responsibility in your role to build a culture of wellness where self-care is the norm. Awareness, intentionality, and practice will prepare you to act when you've identified a struggling trainee. Thank you.